Hi, I'm Dr. Jared Nielsen. I'd like to talk to you about a very important concern that we see in our communities everywhere, and that is concussion. And how do we treat that concussion once a person's suffered or sustained a head injury? First of all, it's asked again and again, should we initiate an anti-inflammatory response on the very onset of a concussion? And the answer is no. If we start to give strong anti-inflammatories, be they herbal or any other type of a medical or over-the-counter anti-inflammatory, we're actually slowing the brain's ability to heal. So when we look at the initial stage of a concussion, there are some phases that we want to allow the brain to go through. Let me just describe this way. During the first week of a concussion, we should actually reduce our caloric intake and decrease our carbohydrates, increase proteins, and fast intermittently, meaning every other day we should encourage fasting for up to 17 hours. So every other day, someone should have their breakfast and then skip and then not eat again for 17 hours. And that intermittent fasting will actually allow the brain to start to look for proteins or break down byproducts of the cells to use as energy. The microglia in the brain are specific cells that actually help to clean everything up. And if we stop them too soon, they don't actually have the time to heal the brain. So again, fasting 17 hours every other day, increase our proteins in our diet, decrease the carbohydrates and potentially even eliminate them, decrease the caloric intake, meaning if you're not as active, you don't need as much food. And then increase blood flow, which equates to increasing oxygen to the brain. When we look at increasing oxygen to the brain, a lot of people will say, well, shouldn't I use something like L-arginine, for example, to open up the blood vessels to the brain? And while that may be helpful in some cases, it actually can create a pro-inflammatory response as well. So there are a couple of products that I'd like to just mention at this point. They're produced by a company called Apex Energetics. And on this, one of these is called Neuro 2, and the other is called Nitric Balance. And these help to increase the oxygen to the brain. In our office, we actually use hyperbaric oxygen therapy as well in those initial stages to really encourage, again, healing and oxygen to the brain. After the week, post 1 week, we want to restore our caloric intake and really start to look now at allowing the brain to start to heal from another phase. So we start to introduce some of the natural anti-inflammatories. And again, from Apex Energetics is a product, called NeuroPTX. And this should be added at this point. This really helps to engage the brain's anti-inflammatory responses, but not until that post-week, and then really encouraging decreased inflammation from days 14 through 28. Now we're going to use DHA to EPA, which are your fish oils, your fish body oils, algae oils, to help the brain to heal. So in a DHA ratio of 20:1, we actually restore synaptic connections. We use a lot of DHA EPA ratios in the 20:1 ratio for children with developmental delays of the brain. So again, as we're trying to heal from a concussion, these are the real keys. DHA 21 initially, and then progressively going to a 4:1 ratio. Now during this time, again, as we're focusing on decreasing inflammation, another product from Apex is called NeuroFlam. And this is an anti-inflammatory product that actually helps to increase glutathione in the brain and increase glutathione levels there to restore brain function. Now, naturally, growth hormone is released in our brains as we sleep. And so a person with a concussion, post-concussion, should really focus on allowing their brain the time to heal while resting. So sleep is important because the brain actually releases growth hormone while this sleep occurs, and therefore the brain can heal using its own natural hormone response. Now, the other key to this is, of course, the healing aspect of the brain. Remember, a brain injury such as a concussion has three components. There's the brain area that's actually had the trauma. There's the balance center or vestibular center that's potentially experienced trauma. And also the pituitary that has a connecting stalk or a response that can then potentially decrease mood and hormonal output. That's on another video that you can reference again and see how that correlates. This whole plan for concussion really again has to do with the ability to allow the inflammatory response to occur in the first week, begin to allow that inflammatory response to start to mop things up, but don't shut down the inflammatory response until 2 weeks post-concussion. I'm Dr. Nielsen. I hope that's a help to you and your family. Thank you.